Hi, if you are over 35 and planning to conceive, or you're under 35 and haven't been able to conceive despite trying naturally for a year, or maybe you have problems like irregular periods, then this video is for you. I'm Dr. Bhargav Raut, the Chief Pathologist at Pathofast Lab and Diagnostic Center in Pune, and we do whole hosts of fertility tests for women of all ages. Today, I'm going to tell you which is the most important set of tests that you need to do if you're planning to get pregnant. Look, before we get started, there's one thing you have to understand. Fertility in a woman, it's all about hormones. Every single hormone has to be present in your body at the right time, in the right amount during your cycle for you to be able to conceive naturally. Right from maturation of the follicles inside your ovaries, the release of the egg from your ovaries, the implantation of the egg into your uterus, preparing your uterus to receive the egg, all these things are controlled by hormones in your blood. And the only way to target and to measure these hormones is through blood tests. That's why blood tests are the most important thing while checking a woman's fertility. Now, what I've done is I've grouped the fertility blood tests into 3 simple groups so that you will be able to understand very easily which one you should do. The first are the tests which tell us about your fertility potential or egg reserves. Every woman is born with some number of eggs in each of her ovaries, and over time one single egg is released in every menstrual cycle. So there are blood tests which allow us to know how many eggs you still have, and these are the tests that we group under tests for ovarian reserve or fertility potential. The second is the tests that tell us whether you are ovulating or not. Ovulating is when your ovaries release that single egg during every menstrual cycle. And the last set of tests are the ones which we call supporting hormones. These are the hormones which are necessary for the proper maturation of the egg, its implantation, and also for the development of the right environment for the embryo to grow. So all these are the different tests, and they are in these 3 groups. Now I'm going to get into each group separately. So let's start with the egg supply or fertility reserve tests. There are 2 tests in this category that you need to know about. The first is the AMH test, also called the Anti-Müllerian Hormone blood test. This test, put simply, allows us or the doctors to get an estimate of how many viable eggs are still present in your ovaries. With age and time, the number of eggs will reduce, and so does the AMH level. But the best part about the AMH test is that you can do this test at any time in your cycle. It is not affected by any medications, and it gives doctors a generalized idea of how many eggs are still available. This is especially useful if you're planning to go in for assisted reproductive techniques like IVF. At the same time, what you need to remember is even women with low AMH values have been able to conceive, and very high AMH values are also not very good. So what is a good AMH value to tell us that you have adequate egg supply to be fertile? Well, as a rule of thumb, any value between 1 to 4 is considered to be a good value for AMH. Values as they go on reducing below 1 indicate that there are fewer and fewer viable eggs that could be used for fertility, and values above 4 or maybe above 5 or 6 indicate that there may be too many cysts or eggs, which is something that we see in a syndrome called PCOS. The second important hormone in the egg supply tests or the fertility reserve tests is the FSH, also called as Follicle-Stimulating Hormone. The only job of this hormone initially is to promote the growth of the eggs inside the ovary before they are released. So you will realize that if your FSH level becomes very high, that is because your body is actually trying to promote more and more eggs to grow inside your ovaries. At the same time, if your FSH level is very low, the eggs will not grow properly in your ovaries. So doctors use FSH levels as a way to judge how well the egg maturation is going on in your ovaries, and so it gives us an idea of the fertility potential. A good FSH level is somewhere below 10 or equal to 10. Now, what you need to remember is that FSH is something that should be tested around day 2 to 5 of your period. That is because that is the time when we get baseline estimates of the FSH level. They are not to be tested at other times of your cycle. The second group of fertility tests that you should be looking at are the ones which tell us whether you are ovulating normally or not. And this might be the most important group of tests, especially if you are trying to conceive naturally. The first and most important test in this group is the LH test, also known as the luteinizing hormone. This hormone has only one job, and that is to cause the egg to be released from your ovaries around the time of your mid-cycle. If you have ever used ovulation strips before, or your doctor had asked you to measure your body temperature throughout your cycle, then what they were trying to find was whether you have been ovulating or not. The LH or the luteinizing hormone is something that suddenly spikes just 24 hours or 48 hours before you ovulate. And ovulation is obviously essential if that egg is to be fertilized by a sperm later on. So the LH level is very important for us to know whether your body is capable of releasing the eggs in every cycle or not. Now, one thing you need to remember is that if the LH level is very high, it could indicate that there is something wrong with your ovaries, that the ovaries are not functioning properly and they are not releasing the eggs properly. Because when the body realizes that it is not releasing the eggs, it tries to make more LH and somehow stimulate your ovaries to release the eggs. At the same time, there could also be changes in the LH level if you have something like PCOS or PCOD. Another important thing to remember is LH is another hormone that should be measured between day 2 to 5 of your menstrual cycle, because that allows us to get a proper baseline value of LH because it changes throughout the cycle. The next important test in the test for ovulation is called the progesterone test. Progesterone is another steroid hormone that is present, and its basic job is to prepare the uterus to receive the egg that was released from the ovaries at the time of ovulation. So the luteinizing hormone causes the egg to be released from the ovaries, and thereafter the progesterone hormone prepares the uterus to receive that egg. Now, the progesterone level is something that we usually like to measure in the second or the latter half of the cycle, usually between days 21 to 28. A good value is around 10, and if the value is too low, it may indicate that there was no ovulation that took place, because if the egg is not released, the progesterone levels would not rise to prepare the uterus to receive that egg. So progesterone is also a very important hormone that should be checked. The last group of very important tests for fertility are hormones that do not directly cause any change to the egg or its release, but the ones which are actually required for a proper maintenance of your cycle and conception. In this group, there are a diverse set of hormones like thyroid, prolactin, steroid hormones, as well as estradiol, and I'll go into each of them in a subsequent part of this presentation. But what you need to remember is that all these hormones are equally important for you to be able to conceive naturally, and all of them should be tested if you go in for a blood test. So estradiol or E2 is another hormone that is necessary for preparing your uterus to receive the egg. It prepares a fertile cervical mucus, which is basically the fluid lining of your uterus. It prepares that lining properly to receive the egg. It is also necessary for proper maturation of the egg and a bunch of other things that are required for this egg to be properly maintained. Now, estradiol is another hormone which we measure around day 3 or 2 to 5 of your cycle, and an abnormal level may still indicate that there is something wrong with your ovarian reserve or the number of fertile or supply of eggs that are available, even if your FSH level is normal. So that is why doctors will advise that you do the estradiol as well as the FSH test at day 3 of your cycle. The next is the prolactin test. Prolactin is basically a hormone which is required after a mother has delivered her baby. It stimulates the breast to produce milk to feed the child. That is its main function. But in some situations, there is a growth in the brain of the woman which causes a very high level of prolactin, and this actually causes infertility by preventing ovulation or release of the egg. That is the reason why prolactin is always measured when you complain of infertility or when you are planning to conceive. Other symptoms that you may experience if your prolactin levels are high could be weight gain, breast tenderness, breast discharge, vaginal dryness, and several such related symptoms. The next is the good old thyroid test. What you need to realize is that the thyroid hormone is critical for proper fertility in a woman. A low or poorly functioning thyroid gland is actually one of the very common causes of poor fertility. The thyroid is also very often responsible for the symptom of irregular periods, which is present in many women who also complain of infertility. So getting your thyroid hormones checked is very important. You should ideally do the FT3, FT4 and TSH tests to properly evaluate your fertility and thyroid gland. The last in this group of supportive hormones is the tests for the various androgens. Included in the androgens are tests like DHEAS, androstenedione, total testosterone, free testosterone, and the free androgen index. Now, this is a group of blood tests which tells us whether there are too many androgens or male hormones present in the woman's blood. This can cause problems with follicle development as well as complete derangement of your menstrual cycle, all the way to where you may not even have periods at all. If you have symptoms like hair on your face, excessive weight gain, hair on your arms or your back, a hoarse or a deepening voice, you should definitely get all your androgens tested as well. So this is one of the most common reasons for women who are experiencing infertility is these elevated levels of these androgens. To summarize, blood tests are a critical part of evaluating a woman's fertility and fertility potential, as well as the causes because of which you may not be able to conceive. All the tests that I have listed are equally important. There is no one test that you can skip or that you must do just to know about your fertility. Please consider all the 3 groups of tests as well as all tests in each group. If you need further help, please drop it in the comments below and I'll definitely do my best to respond to you at soonest. If you are in Pune and you're considering to get tests for fertility, do get in touch with us or click on the link in the description, which will take you to a panel of tests that we have specifically designed to evaluate your fertility. It's important to remember that you should do all these tests between day 2 to 5 of your menstrual cycle. Day 1 is the first day when you have had your bleeding or what we call the period, and thereafter we count each day. So you should do these tests between day 3 to 5 of the cycle to get the most reliable results.